Hello everyone, welcome back to the channel. Today we are going to discuss about one of the most common and confusing areas, that is trigger point injections and the condition known as trigger finger. First, let's talk about trigger point injections. What is a trigger point? A trigger point is a hyper irritable spot in a band of skeletal muscle or fascia. A doctor injects a local anesthetic, often with a steroid, right into that spot to relieve pain. So this is called as trigger point injections. Okay. This is the crucial part for coding. We should not code based on the number of sites injected or number of injections. You should code based on the number of muscles. We have two main CPT codes for trigger point injections, that is 20582 and 20583. 20582 is for one or two muscles, 20583 is for three or more muscles. So what is the one or two muscles rule? Let's say the physician injects the left trapezius and the right trapezius, the same muscle, just on the other side. If they stop there, you should use 20582. The code is based on the muscle group, not the site. We'll see another one example. If they inject the left trapezius, that is muscle 1, and the left rhomboid, that is muscle 2, then you should bill 20582 for two muscles. If they inject trapezius, rhomboid, and the levator scapulae, that is three muscles, then you should bill 20583 once. Simple, right? Here is an important tip for bilateral injections. If they treat muscles on both the left and the right side, say three muscles on the left and three muscles on the right, you would still use 20583 and apply the bilateral modifier or 2 units depending on the payer specific guideline. So the second thing is, what is trigger finger? Trigger finger is a condition where a finger or thumb gets stuck in a bent position. It happens when the flexor tendon sheath in the hand gets inflamed and thickened. Trigger finger is also called as stenosing tenosynovitis. Treatment of trigger finger involves a steroid injection. That is completely different procedure from the trigger point injection. So it is the steroid injection into the tendon sheath. You should use the code 20550 or 20551 depending on the documentation. So TPIs are into the muscles, not the tendon sheath. Alright, let's do a quick recap. Trigger point injections, code based on the number of muscles injected, not the number of injections. 20582 is for one or two muscles, 20583 is for three or more muscles. Let's see few more examples. If a physician gives 5 injections into the right trapezius, 4 injections into the right rhomboid, and 3 injections into the right levator scapulae, you have a total of 3 muscles treated. So the code is 20583 into 1 unit. Laterality does not double the count. Treating the right trapezius and the left trapezius count as one muscle. That's all about today's topic. Thank you. Follow Medco Navigator for future updates.